Hello, Dr. Perkins. This is Elizabeth McGill. Unfortunately, once again, I'm unable to download something, so I'll be placing this on YouTube. I'll email you information on that. So here we go.
Hello, this is Elizabeth McGill talking about home health care services. Due to the increasing aging population from the baby boomer generation, healthcare has seen a need to provide services. Agencies that provide home health care and hospice, in particular, have increased. There is a higher usage for women than in men. Used by patients, mostly by patients over the age of 65 years. These home health care services were skilled nursing, physical therapy, ADL training. Now, OT and wound care were also involved, but they weren't as big in the percentages as the former mentioned. Most of these patients have cardiac issues, not surprising, due to the fact that heart attacks are still the number one issue in America. Also, as we get older, our cardiac output is not as efficient as it was when we were much younger. So it's not surprising that most of them do have cardiac issues. Now, in my line of work, I work as a physical therapy assistant. Patients in a hospital, patients don't want to go to a nursing home or a subacute in the first place. They associate a subacute with a nursing home. Now, it is true that some nursing homes do have a subacute component to it, but they separate them out. And even after that education, they still don't want to go. Patients and families are also becoming better educated on their options. You know, when they bring a loved one to the hospital, they already know their options before you even give them to them. They know that there's home health care, subacute, acute, hospice, in-hospice, home hospice. They know these options already. And sometimes you'll go, quite literally, the day after you receive they get there, and now you've received your orders to go for physical therapy. You get into the room and they're like, we want Dad to go to acute care facility, and you're like sitting there going, well, I gotta get him up first to make sure he can go. And they're like, no, we want him to go to acute care. And you're like sitting there going, okay. So that usually, without a proper evaluation, sometimes that becomes a problem. But these families are much better educated on their options. So just to go into a story here, of course, I have a million of these. This is my mom's story. Now, my mom had a total knee replacement about a year ago, I want to say, because the baby's tiny. She had to have a picture before she had to have it done, because she's like Irish and, morbid and whatever. So, my mom going in, and this is what I mean about the educated patient. Now, my father's a nurse, my mom's a bio teacher, I happen to be a physical therapy assistant, so she was well educated on her options before she even went into that surgery. And of course she would always ask me if she was okay to come home. I'm like, Mom, you're only having one knee done. And that's the thing. Nowadays, if you're only having one knee, one hip done for a total hip, total knee replacement, they are not going to send you to a subacute because you will not get the approval from the insurance company. Okay, so that's also why home health care has also increased, is because, insurances are saying, no, these patients can go home unless there isn't a medical need. Now, by that, it's more of like, God forbid you had a stroke while on the surgery table, or God forbid your blood pressure went out of control for some strange reason, or whatever else could happen to you medically, so they will not send you home unless there is a true medical need. If you've only had one replacement done. Now, if you've had both done, they'll send you, because then you can't get around the house. Plus the fact that my mom had a caregiver. That's also another reason. If you don't have a caregiver and you can't get around, they still might send you home. It just depends. you're more likely to go home. But, so I was always telling her, yeah, you can come home. It's not a big deal. So she finally got home. She got her home health care services. She had a physical therapist come in 5 days a week. Visiting nurse services come in for the wound on the knee. Eventually, this took months, of course, of physical therapy. She was able to eventually not have it anymore, got discharged, and she was happily on her way again. Now, another reason my mom did not want to go to a subacute or acute care was because she did not want to get MRSA or C. diff. Yeah, that's also another reason why patients don't want to go. They already know that that's a big problem sometimes in these facilities, is the MRSA and the C. diff and whatever other funky stuff you can get. But, because we know about it and they know about it, everybody's, we're very cautious on where we put patients and stuff like that. But she was having none of that, so she went home to her own home, and she liked it much better because she was able to take her own shower. We already had a handicap and everything. And that's another dimension too. Most patients who go home, I'm saying most, have a handicap accessible area. Now, what do I mean by that? Do they have stairs? Maybe. So they have maybe 1 or 2 steps to get into their house. We can give them a 3-in-1 commode, which will raise their seat on their toilet bowl so that way they can sit down properly. We can give them a shower chair to put into their bathtub. They have handheld showers now. Railings put in. Mostly because there's a generation that's starting to take care of their older family members, because we can bring them home and take care of them. My mom and dad in particular, we have a handicap accessible bathroom in their house due to the fact that my mom's mom lived with us when from the age of my age of 12 until I was 16, when she passed away finally. They handicapped her section of her bathroom, because they knew that she needed it. But you know what? It comes in handy later on, especially as you get older. My husband and I, despite the fact that we are young, our bathroom is handicapped, except for there are no handrails, guardrails yet. Not been afforded. We do have a raised toilet seat, and people do this too. So this is also why people are taking them home, because they can take care of them. There's a home health care agencies that will help you take care of your family member if they have dementia, Alzheimer's, until they become more of a wandering issue, should I say. It's a polite way to put it. But this is the trend now. It is becoming a big trend, because the more and more that the healthcare agencies are getting involved with healthcare, despite their lack of knowledge, which I'm going to put it out there, they deem it possible that if you've only done XYZ, you get YZX. So, unfortunately, our own insurance companies are kind of dishing out where we can go next. Do I think healthcare is for everybody? No. Do we send a lot of patients home with home healthcare? Yes. We do. It is a very good option for a lot of people, but it's not the best option for everybody. So therefore, we always suggest what is most appropriate. Now, of course, for the most appropriate thing for my mom was to do the home health care. For the next person, maybe not so much, depending on their issues. Today, everybody is good, of course, and I would definitely, you get a good healthcare agency in there, and you will have a very, very good experience. But that's also another issue to get into some other time. So, thank you very much for listening, and have a good night. Bye.
Okay. So as you can tell, I'm sorry about this. Hello. I kind of made a few errors, but I hope you had a good time listening to that. Thank you very much. Bye.